I know there was a question about, do orthotics actually work? Well, yes, if the idea is that your foot needs to be in a neutral position, right? And some of us do what is called overpronated. So you turn your foot in too much, or maybe you turn it out too much. That can add to pain in your feet. And so having something that's custom made to your foot can often help. And what's nice, unfortunate thing is that insurance doesn't always cover these, and they're not the cheapest things. You can buy some over-the-counter ones, but having other issues, sometimes it's better to get a custom orthotic. You can use your flexible spending account stuff for that if you have, if you have one through your insurance, but having one custom made to your foot makes a big difference. And it has for me. I've struggled with plantar fasciitis over the years, and having these orthotics is what helps me decrease that inflammation and get past it. The other thing about orthotics, it's not just for your feet or braces for your knees. There's the ones for your hands. So when Janine was talking about sleeping, and I know this looks like an awful thing to put your wrist in when you're sleeping, but I have a couple of different versions from post-surgery, and one when I was, just flaring, and had to have a new one because your joints change over time. Having this for 20 years, I've had probably 6 of these made, but the idea, when she's touched on neutral position, is that when you are sleeping, it gives your wrist and your fingers and your hand the opportunity for your joints to rest in what we call a neutral position. If you have your fingers balled up and you sleep like this, it's not helping to decrease inflammation. You're causing more strain on those small joints in your hands and your wrist. If you're sleeping on your side or sleeping on your arm and you're bending your wrist, that's not going to help. So oftentimes having a resting splint made custom for you by a hand therapist or OT or PT who can actually make these is important. It's what got me through the first couple of years of having a lot of flares, and you get used to it after a while. And then you wake up in the morning and you're not as stiff and swollen. And so to answer your question on orthotics, I highly recommend it. Depending on the joint, you would go to a PT or an OT or a hand therapist. If it's your hands, definitely a hand therapist.
Rebecca, can I show my splint now that you're showing yours?
Yes.
Okay, so I have osteoarthritis, and there was a couple questions about sleeping with osteoarthritis with the base of the thumb. And actually, these small little orthoses can be made by a hand therapist or an occupational therapist, or some physical therapists can make them. And it actually provides stability to your thumb, lines it up. And actually, there was a question about how do I get my thumb stronger? Actually, this has been demonstrated to, if everything's lined up, you actually are more stable and you're actually stronger and have less pain at night. And just wearing them at night seems to help through the day. So if you have a lot of pain with your thumbs and you feel difficulty with pinch, there's an orthosis for you that can really make we've got almost 6 systematic reviews showing these puppies to be terrific. So sorry, I interrupted.
No, I'm glad you did. I know a lot of people struggle with arthritis in their thumbs, and my mom's one of them, and she has a splint for her thumb. And the most frustrating part about it was, I can't bend my thumb. Well, you're not, that's the point. Like when you have pain at the bottom of your thumb, you do need to rest it, right? Mm-hmm. And adapt how you're doing that pinch. That's why it's important to see a hand therapist, so you can learn these things and do exercises to strengthen the small muscles in your hands and your thumbs and fingers. But as Janine said, just like my wrist resting splits that I used to use all the time, if you at the very minimum use a thumb splint at night, it will really give your hands and your thumb an opportunity to rest and help calm down some of that inflammation.